My name is Dr. Mansi Chowhan. I am a breast cancer specialist at Fortis Hospital, Manesar, Gurgaon. I have been working in this field for more than 15 years now. I am really passionate about women health and the conversation around breast health and cancer.
Dr. Mansi, my first question is what exactly is breast cancer and how does it develop?
Breast cancer, like any other cancer, is when the cell grows uncontrollable. One cell to two cells, that happens every day in our body. That is a normal cell cycle, normal growth pattern. But when this happens in an uncontrolled way, that is when cancer forms. So when it happens in breast cells, it becomes breast cancer. When it happens in lung cells, it becomes lung cancer. So that is what essentially cancer is. And the very common question which everybody will ask is, why is that happening? We don't know, unfortunately, the reason behind why. What we know are the risk factors, that when we indulge in such kind of practices or when you have these risk factors, maybe the chances of getting breast cancer increases.
What I want to also understand is what are some of the early signs or symptoms a woman shouldn't be ignoring?
Each and every woman, and in fact young girls also, should be aware about very basic symptoms of breast cancer, because you are the ones who are actually reaching out when you find them. So what to look for is very simple, that is a lump in the breast. So this is the most common symptom which can happen. It can happen in either of the breast or both the breast. It can also happen in the armpit region, or it can also happen on the skin. So any lump which is there, whether very deep seated or on the skin, is one of the very common initial symptom. Then there can also be skin changes like redness, swelling, any rash of the skin. There could be any changes in the contour of the breast. It could go puckering or retraction or even a bulge over the skin. And there could be changes in the nipple. The nipple could be pulled inside, that is called retraction. So all these are very initial or early signs. So having said that, there is a very common question, that is pain in the breast, which is a very common symptom in women. But unfortunately, pain in the breast is not a symptom of breast cancer. Even if women are having pain, that could be like a very hormonal cycle changes kind of a symptom, or there could be 100 multiple reasons of it. In breast cancer, pain is a symptom which happens very late. So it's not a very early symptom. That is when the nerves get involved. So pain is not a very early symptom of breast cancer.
You very briefly mentioned about factors that contribute towards women developing breast cancer. Could you elaborate on the factors?
Risk factors, just for example, we say that smoking can cause lung cancer. But it does not mean that all smokers have lung cancer and that all lung cancer patients smoke. So by risk factors, what we understand is that if we indulge in such practices or if we have these factors, then the chance of getting cancer increases. And this can broadly be classified into lifestyle factors and genetic factors. So genetic or familial factors happen because of the genetic mutation. So if you are carrying a gene in your family that is mutated, that is the familial or genetic cancer. But that happens only in 10 to 15% of cancer. So the majority, that is 85% of cancer, is actually happening because of the lifestyle factors. And what are these lifestyle factors? These are stress, this is alcohol consumption, this is lack of balanced diet, lack of exercise, obesity, smoking, eating unsaturated fatty acids. So all of these are actually causing. So you might think that this is a very basic or simple thing which I am talking about, but there are studies and evidences which have proven that obesity or lack of exercise or even alcohol and alcohol plus smoking will increase your chances of getting breast cancer.
Can young women get breast cancer? If yes, what's the youngest patient you've seen?
Yeah, thank you so much for asking this question, because most of the time when we go on internet and try to search about breast screening and what is the probable age of breast cancer, because we see a lot of Western data, we are seeing an age group of 40 and even above. But in India, unfortunately, we are seeing a lot of young women. Indian women, I would say even in 30s and 20s, they are getting breast cancer. It could be because of urban lifestyle that we are in, or the type of food we are eating, or the environment which we are in. So I have treated even a young patient of 16 and 18 years of age. So whenever we say that there is an age cutoff or when should we start breast screening or checking ourselves, so I would say there is no age limit, because I have treated a woman as young as 16 year and also 94-year-old lady. So there is no age limit cutoff for such disease.
Do you often see cases where sometimes the diagnosis or the screening has happened too late because there's shame around? So let's talk about the shame between a mother and a daughter amongst friends. Could you talk about such cases, please?
Actually, interestingly, this is one of the reasons why I chose this branch. because when I was doing my surgical residency, there are very few female surgeons which are there. There were a lot of patients who used to come to us with huge fungating masses, with pus discharges and smelling bad wounds on the breast. So that is a stage which is very advanced stage of cancer. That happens when the wound is bleeding and there's a lot of pus. So I used to wonder, and I used to ask them that what is your problem, like why are you living like this, why did you never came to a doctor or seek any medical advice? And they would say that I did not wanted to see a male doctor. Usually even in our country, with any kind of breast symptom, the lady would first try and find a lady doctor, and that would be gynecologist most of the time. So those are the people who are actually seeing breast problems initially. So there is a lot of shame. The shame is there within the family, the shame is there within the person as well, and then the shame in the society. So we have to address all of them so that this becomes not so stigmatized disease, because this is actually preventing us of winning this disease in India. What we are seeing in India is more than 50% of the cases are diagnosed in advanced stages, that is stage 3 and 4, and stage 1 and 2 are early stages. So these are the stages where we can give more than 90% of success rate or cure rates. But just because of this shame, patients are not coming to us, and we are not able to provide that kind of cures to the patient. There have been examples of women who will not talk in the family, even to the mother or daughter. Then sometimes the mom-in-law is there, she cannot speak to the son or to the daughter-in-law. So there was a and it has nothing to do with education or the status of living, because in COVID something I had noticed was a very well-to-do family living in Gurgaon, and the lady, she was similar situation, tumor which is spread to the skin and as it's foul smelling, but she did not address it because she did not wanted this to tell this to anybody in the family. So this shame or the stigma is there in all parts of our society.
The daughter-in-law and the mother-in-law relationship, how do you think this has to change?
So actually all of us, all the daughters, we have been taught about menstrual practices and hygiene by our mothers. So unfortunately we are still not very much dependent on the school for such kind of education. So when this is happening, we also have to address the breast health. So at that very age, in the teenage, the girls should be taught that breast is also going to have a lot of changes in your entire course of life. So at that point of time, the breasts are developing, then she will be sexually active, there will be changes. Then in pregnancy and breastfeeding, there will be other changes, and then finally during aging, there will be sagging and everything. So all this is never discussed, never conversed about, and hence you will be surprised to know that no women will actually do a self-breast examination also, considering this is not even a part of her body. So this is very strange, and this can only happen when at the time of education of menstrual hygiene and practices, when we start talking about breast health as well.
How early should women, girls start breast examination, self-examination?
So I would say as early as they understand why we are doing this. As compared to West, our female are sexually active a little later in age. But even having said that, even a 15-16-year-old girl, when she understands that why are we doing this self-breast examination, she is adult enough to understand that is when she should start. So even if not 16 but 18 is something she should definitely start doing her self-breast examination. It is nothing, it hardly takes 10 minutes, it is you checking yourself, and it should be done once in a month. And there will be hundreds of videos available on YouTube to how to do it. So there is no need to go anywhere, tell anybody, you're just checking yourself, being breast aware, that's it.
What are some of the lifestyle changes that they need to do in order to prevent breast cancer? So
this is very important for all of us to understand, but having said that, there is no actually a very strange answer to this. What I'm going to tell you is something which all of us know, and this is something which should be practiced by everybody, not just women, and this is going to prevent you from many diseases including breast cancer. That is a balanced diet. So you should include all kinds of green leafy vegetables, vitamins, minerals, fruits and everything in the diet. More of fiber, less of refined carbohydrates and processed meat and processed foods and preservatives. This is something which everybody knows, but this is also going to reduce your risk of cancer. This is also important to understand. Then physical exercise, so at least 3 to 4 hours of exercise per week is something which is recommended. Maintaining a healthy weight, And then obviously knowing your facts. So for example, if you have some of the high risk factors, if you are belonging to a high risk family, or if the doctor has told you that you are in the high risk category, then you should know your facts. You should know about your risk factors. And then screening, that is checking yourself, that can be done as a self breast examination or an annual screening with the doctor.
What's this one thing you wish more women start doing in order to prevent or get an early diagnosis? One thing.
The one thing, if you ask me that I'm granting you a wish that if you say this, every woman will start doing this, is self breast examination. Now questions asked, because if they start doing that, we will definitely be able to pick up this disease at a very early stage. And women who are more aware about their own body, their own self, are the kind of women we want in our country.
One message to schools and teachers in particular for raising a generation of young girls, what would you want to tell them?
For the educators, it is important that we have actually focused too much upon menstrual hygiene and health, but this is time, because unfortunately breast cancer is the most common cancer in India and across the globe. So we need to shift our focus a little bit to the breast health as well, and there is no shame in talking about it. So at that very early age and the naive age, if you have a very casual conversation about it, then it becomes a trend later in your life. So this is a subject, a topic which should not be stigmatized. We should be able to talk about it in a very casual way. So that can happen at that age and with the help of the educators.
Great. Thank you so much, Dr. Mansi. I think this was really informative for me as well.
Thank you.
Thank you.